Nursing 210, final. Examining a patient's skin first. We're going to look for macules, lesions, any abnormalities. And there are several small macules on his right cheek, as well as the left side of the temporal. Male pattern hair distribution, short, non-coarse, no lesions through the head, moves freely, the scalp. Looking at, you sit just a little bit. And no other lesions noted. Male facial hair pattern as well. We're going to look at the symmetry, and there's warmth all the way down through the arms, down the legs. Toes are nice and warm, pink. If you'll hold your hands out for me. Nails are all nice and intact, short. And if you'll take your fingers and do this for me. 1/60 of angle those, no clubbing, no ridges, smooth, and no hangnails noted. I'm going to check the eyes. We're looking in the eye for the fundus of the retina. So if you'll sit up nice and tall, I'm looking for the back, towards the back of the eye for the gray cloudy area. Just look straight ahead. And when you look in the back of the eye, you should see the red optical nerve area. So if you look straight ahead, I'm going to check for with the light for a reaction of the pupils. They're equal and reactive. All right, the convergence exam. If you'll cover one eye for me and tell me when you see my fingers coming into your vision.
Yep. 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 Yeah. Yeah.
All right, that tests cranial nerves 3, 4, and 6. We'll look at the ear using the otoscope. I'm looking for the tympanic membrane. If you'll just tilt your head slightly. I'm looking and see the gray, smooth tympanic membrane, as well as the stapes behind there with the Inca and the the 3 small bones behind the membrane to ensure that those are nice and clear. The ear itself is does have some evidence of psoriasis inside the ear, some loose flaky skin, but no areas of redness or pus or active oozing. Alright, and I'm looking straight at the face. Both eyebrows are equal and full. There's no flakiness noted. Eyelashes are intact. We'll look at the nose and see if we can note noting the membranes and the turbinates as well. Can you hold your head up for me? inferior turbinates are noted. There's no drainage, no source. Cannot note the inferior turbinates, the distance of those. All right, we'll do the olfactory testing with that would be cranial nerve number 2, and just let me know what you are smelling here.
Vanilla.
And which is this one here?
Vinegar.
Okay. And again, that tests the olfactory nerve number 2. All right, for the cranial nerve number 5, the TMJ, have you open and close your jaw, and there's no clicking felt, no popping. If you'll take your take your jaw and go side to side with it, back and forth, and put your lips together and like you're pursing, like blowing a kiss, and then when you're blowing a bubble. All right, and with your eyes, I want you to close them tightly and we'll try to open them. All right, nice and tight closure there. There's no redness, excessive redness noted. There is some noted due to allergy season. I'll fill over the lacrimal duct and sac. Nice and smooth, no pustules or fullness there. All right, with your fingers again, can you do this for me, please, and touch your thumb into inside of your pinky? All right. Able to move his fingers back and forth without any problems there. All right, so for to test cranial nerve 11, have you pull your shoulders up as high as you can and push back down against me. Push up, nice and tight there. No problems moving them. And we'll feel for the lymph nodes. We have the presinus ones, the inferior, and the anterior, and the posterior, and the deep cervical, and the ones underneath the chin. Also on the vision, we would be checking for distance and near using the Snellen and the Romsburg for the near vision. He does work corrective lenses, and we would have done that prior to, and that would need to be at a 14-inch distance. All right, so I'll have you open your mouth now for me, and let's just take a look and make sure everything is nice and pink, big and wide. And there's evidence of wisdom teeth being removed. So he has 27 teeth, all nice and pink. There's no lesions or any open sores in the mouth tonight. Stick your tongue out straight to me. All right, and say ah. Big and wide, and say ah. And the tonsils were removed at an earlier age. Sticking the tongue out is cranial nerve number 11. Cranial nerve number 11 is sticking the tongue out for the hypoglossal. All right, I'll have you go ahead and lay down for me. So I'll be looking at the thoracic area, the chest, looking to make sure there's even respirations and no abnormalities noted with respiratory effort. It's all nice and even. No problems with respirations. We'll go ahead, since he is laying, I'll do the chest exam first, and I'll listen here. Going down to the third intercostal, we have the tricuspid, and this is at the left midclavicular line. To the right midclavicular, the second, we have the aortic. And we'll be listening both with the diaphragm and the bell. Again, the third one, the tricuspid, the bell, and then the point of the PMI, the point of mid, is also called the apical pulse, which is midclavicular fifth. And those are all without any murmurs noted, as well as feeling. You can feel the pulses at the apical without any murmurs. S1 and S2 heard through those. I'll start at the head and work my way down for the pulses. So I'm going to start. I'll be starting with the temporal pulse. And this would be assessed on both sides. The carotid. You can palpate or you can auscultate those. No thrills or bruise felt. Brachial. Radial. Deferring the femoral. Popliteal behind the knee. Dorsalis medius. And tibial pulse. And those are all within limits. No bruise or thrills felt with any of those. Okay, I'll ask you to sit up here on the side of the bed again, please. All right, sit up nice and tall. I'm going to watch for chest expansion and with breathing. And then across the back at the 10th intercostal, I'm feeling for thoracic expansion. Go ahead and take a good deep breath in. Good. All right, I'm going to put my hands on your back and I'll have you say 99. And I'm feeling for vibrations on the ulnar side. Okay, go ahead and start.
99. 99.
Nice. All right. So I'll do the percussion using my middle finger, back and forth, all the way down, side to side, making sure we have the same vibrations, and we want to hear resonance to dull. I'm going to check for diaphragmatic expansion. So I'm going to have you take a good deep breath in and hold it. Okay, and let it out. Now, take a good deep breath, push it out, and then hold your breath. Right, and I have marked on his back where those are. You can breathe. And the normal is 6 to 12 centimeters. I have gotten today 7. I'm going to use a tuning fork here and tell me when you feel the vibration on the top of your head.
Okay.
And again on this over the side of the ear.
Yep. Yep.
Now, if you could hold your hand out for me and close your eyes. Just hold your hand, turn it over this way. Thank you. Tell me when you feel the vibration on your hand. Okay, I'm going to do the same thing on your foot. Thank you. Bone conduction is less than the air conduction. Okay, I'll let you go ahead and lay back down. Now we're going to do some musculoskeletal checks after I do the abdominal area. There's a table behind me. Alright, so we'll start with the abdomen. Male pattern hair distribution across the abdomen, a small macule in the middle of the belly, and belly button is inverted. There's no pulsating around there. I'm looking for peristalsis as well as any pulsations, which I'm not seeing any. I'm going to listen for the abdominal aorta to the left of the midline. The renals, and then the iliac. I'm listening for those arteries. Now I'm going to listen to the bowel sounds. 4 quadrants, 5 to 35 per minute would be normal. I'm going to also do percussion across here. I want dull, or resonant, to dull. It would be dull over the bladder area. I'm going to check for the liver. And initially just feeling. I don't feel any sharp edges. It all feels nice and smooth. So I'm going to use percussion, dull to resonance. So I'm here, and we'll come from timpani to dull. To here. And this will be measured. Normal is 3 to 5 centimeters. And that's what I was going to say there. Okay, so I'm going to check the musculoskeletal system. We would do bilaterally. Tonight we're just doing one side. So I'll have you to start with lift your leg. This is flexion, and down is extension. And against me, please, for resistance. And right down. Good. And bend your knee. Flexion and extension. And point your toes to your face. Plantar flexion and back down. Dorsiflexion. And roll your foot around, your ankle around. Okay. Now, what if you take this knee and place it towards your left knee. That would be inversion, and then put your leg up right here. Exversion, inversion, back out. Like for you to take your right leg out to your side here. This would be abduction. This would be adduction. And I'll have you set back up, please. Okay, I'll have you go ahead and stand for me. Can you please bend your head forward and back? Okay, a flexion, extension, and all the way back would be hyperextension. Ears, shoulders, ears to your shoulders, lateral movement. Good. And against resistance. And back. Okay. All right, let's start with the arms. You can bend up, flexion, extension. Do this with your hands and back up. Good. And the opposition, touching your fingers. Good. Right. I'm going to have you walk across the room straight ahead, doing heel to toe. And turn around and come back. Where did you go? I lost you in the video. Good. And if you'll take one arm and point towards your nose, and then the other one. Okay. Now, if you'll just turn straight ahead and close your eyes. And normal swaying with the Romsburg negative. Yogurt raisins on the bed. Okay. You can have a seat on the bed for me. Go ahead and test your reflexes here. We'll do the bicep, radial. Can you sit back just a tiny bit, please? You hold this leg up just a little. And that was the knee, ankle. Those are all positive. We are not testing today for bronchophy, and the abnormal lung sounds. I'm going to be checking you for sensation of sharp, dull, and also tell me when you have, and tell me what number I put in your hand. Okay. So can you close your eyes for me? Let me have your hand. One of them. All right, just tell me what number I have drawn here.
0.
Okay. And this is, you can open your eyes. This is soft, and this is sharp. Okay. So tell me what you feel here.
Soft.
Close your eyes, please.
Sharp.
Okay.
Soft. Sharp.
All right. I'm going to put something, an object in your hand. I want you to tell me what it is. Okay.
Magnet.
Okay. While you're sitting here, I'm going to do a little whisper test with you. I'm going to whisper a couple things and you tell me what I've said. Okay? What did I say?
Baseball, softball, football.
Thank you. You sit nice and tall and check your thyroid here. There's no obvious deviations or hyperthyroidism. So, have you swallowed? Good. We'll listen to over the thyroid as well. Just go ahead and swallow now. No friction, no rubs, no bruise noted with the thyroid. If you'll take your hands for me and go back and forth across on your legs. The opposition of the arms. One other thing we need to check is your the chest. So sitting upright, notice no chest deformity. The breasts are intact. And if you'll just lean forward for me, and then back up. That was all normal. If you could lie down one more time for me, please. We'll check for the telespints and the breast area, the chest, the arm back here. Feeling, make sure it's all nice and smooth and soft, and there's no lumps or abnormalities, which there are none. In the abdomen, we'd also want to be checking for the spleen, making sure there's no ridges or abnormalities. And the spleen is generally tucked up underneath the rib cage, so the intercostal, so you should not be feeling it as long as it is not inflamed. And to check the kidney, let me put this arm behind you, please. Take a good deep breath in. And back out. Okay. And I don't feel any rubs or large masses there with the kidney.